Hey guys, what's up? So what I want to do in this video is I want to just do a quick comparison between the psychiatrist versus the psychologist and what some of the similarities and differences actually are. I find that this is a confused topic for a lot of patients. A lot of patients don't actually know what the difference is, and they're often confused by, are you a psychiatrist, are you a psychologist, are you a doctor, are you not a doctor, etc. So let's try to clarify some of those things right now. To start with, I want to talk about the psychiatrist education. The important thing to remember about a psychiatrist is that a psychiatrist is a medical doctor, meaning they've gone through the same 4 years of medical education that every other doctor you encounter has gone through. So that will be your family practitioner, surgeon, etc. All go through 4 years of medical school. During those 4 years, you spend a lot of time being trained in different areas of basic sciences. In particular, during the first 2 years, you spend a lot of time learning about human anatomy, physiology, pharmacology, microbiology, neuroscience, etc. The second 2 years are composed of clinical training. And during that time, you'll learn to take focus histories, you'll learn to work off of a chief complaint, you'll learn physical exam skills, and how to formulate treatment plans. So the take-home message here is that there's really no difference between a psychiatrist and anyone else who holds a degree as a medical doctor or a DO. After those 4 years of training, the person who chooses psychiatry as their specialty will do an additional 4-year residency training program, and that will be specializing in psychiatry. So the psychiatrist will learn to treat a lot of the complex mental disorders. Some of those complex mental disorders that the psychiatrist is capable of treating include schizophrenia, bipolar disorder, major depressive disorder, just to name a few. So psychiatrists are also trained extensively in psychopharmacology. So you spend a lot of time learning about the different drugs, you learn about their mechanism of action, you learn about some of the side effects that the drugs have, and how to best use those in clinical practice. Psychiatrists also offer a few procedures. The two procedures that are very common in psychiatry are ECT, or electroconvulsive therapy, and TMS, which is transcranial magnetic stimulation. The other important thing to always remember about your psychiatrist is that your psychiatrist is also well versed in psychotherapy. So, very similar to what the capacity of the psychologist is, we also learn techniques in CBT, we are trained in psychodynamic psychotherapy, and generally those things occur a little bit later in training, say during your third and fourth year of residency training. The emphasis shifts from just biological treatments, such as the pharmacological treatments, and more towards the psychological treatments and the CBT and psychodynamic psychotherapy. Psychiatrists can actually choose to then further their training at that point. So, or they can go out and practice. It's really up to the particular provider. They may choose to just go out and practice, or they may choose to continue training in what's known as a fellowship program. So psychiatry offers several fellowship programs that range from 1 to 2 years. Some of the more popular ones are child adolescent psychiatry if you're interested in working with kids, forensic psychiatry if you're interested in the legal aspect of psychiatry or applying psychiatry to legal cases, addiction medicine if you're interested in treating people with opioid addiction, alcohol addiction, etc., and geriatrics for older patients, to name a few. There are several others, but those are some of the most popular ones that people get extra training in. So what actually is the role of the psychiatrist in the grand scheme of things? So in most cases, the psychiatrist is sort of the lead professional and responsible for the care of the patients. So psychiatrist tends to take a leadership role, say, in an inpatient setting, and will be responsible for organizing a lot of the treatment, making a lot of the ultimate treatment decisions, determining when a patient is appropriate to go home, when a patient is appropriate to go to the next level of care, and basically runs sort of the show or organizes the process. The psychiatrists tend to use the criteria defined in DSM-5, so that's the Diagnostic and Statistic Manual, published by the American Psychiatric Association. So we use this manual to make our diagnoses. It essentially breaks down most of the common mental disorders by category, and then based on presentation, based on evidence-based symptoms and presentation, you then make a diagnosis. So it's really helpful manual, and basically every psychiatrist is well versed in the different diagnoses presented there. Psychiatrists also use a variety of testing. So again, as medical doctors, we're constantly doing lab tests, we're doing imaging studies. If we think it's appropriate for a CT scan, MRIs, and we also commonly run lab tests, we do things like TSH, BMP, and hepatic panels. But we also do drug levels, say lithium levels, valproic acid levels, to see how compliant a patient has been with their medication, whether or not they're in an effective dose range. Psychiatrists also use pharmacology to treat the mental disorders. So we have the ability to write prescriptions, again, being that our training is extensive during the residency process in making treatment decisions and medication decisions. We then have the ability to use those drugs to treat our patients. So briefly touching on the psychologist education, which is quite different. So the most important thing to remember is that the psychologists don't attend medical school. They attend a graduate school, and they receive either a PhD, which is a Doctor of Philosophy, or a Doctor of Psychology, Psych D. One of those two degrees are usually the ones that they will go for. The PhD programs, they tend to be more research heavy, so you actually have to put together many research papers, and you have to have a large project that you work on and try to get as many publications under your belt as possible before you complete the program. For the Psych D, it's a little different. It's more clinically oriented, so they tend to focus on developing therapy techniques, because that's the person that's not going to necessarily work in an academic setting, again, publishing and doing research, but more so they're going to be the ones actively involved with patient care, and likely will be part of a treatment team at an inpatient facility or in an outpatient setting. Psychologists, they tend to use more of the psychological testing, so they'll do personality tests, IQ tests, and achievement tests as well. And most states actually don't allow psychologists to prescribe medications. There are a few exceptions, those being Illinois, Louisiana, and New Mexico. Because there's such a high demand for psychiatrists and mental health professionals and such a lack of availability, one of the solutions to that could potentially be offering psychopharmacology training to psychologists so that they can then prescribe medication as well. I don't necessarily think that's a bad thing because there is such a shortage, but at the same time, they are not as well trained in human anatomy, physiology, pharmacology, the way a psychiatrist would be. And it won't necessarily cure our problem as far as providing more mental health professionals. There'll still likely be a shortage of psychologists and psychiatrists available to prescribe, regardless of how those laws change, and they do vary state by state, but as of right now, those are the 3 states that allow prescribing privileges to psychologists. So the most important thing to remember about all of medicine is that it's a team effort. So nothing is ever sort of a single doc working and doing everything. You have a team of professionals working together for the best, in order to provide the best treatment for the patient, plain and simple. So the psychologists are there. They tend to do a lot of the therapy work. They tend to run the groups while they're there and work directly with patients in that capacity. Whereas the psychiatrists will also meet with the patients. They'll also do psychotherapy if that's something that the patient wants. But we will also work on med management during those interviews and help them with the biological aspect as well. The psychologist will most likely see the patients more often, because if you're in therapy, you're probably going at least once a week or more, depending on how serious you are about getting help in that capacity, and depending on availability and timing. Whereas the psychiatrist will probably only see the patient once a month or every 3 months for medication management and to check in and see how they're progressing in their therapy. So hopefully this video just kind of gives you guys a basic idea as to some of the differences between a psychiatrist and psychologist.